Well, hello. This is Dr. Isabelle Amigues, and welcome to the UnabridgedMD Podcast. Here we explore inspiring stories, practical tools, and expert insights for living a healthy life. Whether you're a patient, a healthcare professional, or simply curious about healing, you are in the right place. And as always, if you are looking for something that's so much bigger than just a rheumatology practice, please come check UnabridgedMD, as we are the right place to get you to remission with the least amount of medication. With that said, let's dive in. Well, it is such a pleasure today to be on another episode of UnabridgedMD, where we are going to delve very, very deep into the connection between the mind and the body and the heart, as the name of your practice is. Nurse Practitioner Jennifer Mooney is here with me, and it is such a pleasure. It's one of those meetings where I just knew we would have so much in common. So thank you for being on the podcast.
Thank you so much. I'm happy to be here. It's fun.
Yeah. So I have so many questions, but maybe the first one is how you came about this practice of yours that's putting the mind and body and the heart at the center of the care of your patients. And how did you create this?
Well, so it was actually COVID that gave me the opportunity. I've been a nurse practitioner for 35 years, family medicine. I have a background in metabolic and nutritional medicine, but I've been doing bioidentical hormones for years and all of it. And I've been back in Denver for about, since 2008 again, but had different practices. And I had just joined a practice that wanted me to help him develop a personalized primary care practice in 2019. Then COVID hit. And I had people that had followed me from place to place. And they said, what do you want us to do with your patients? And I said, well, I guess I'll just see what happens. And I found a little office box and started. And it's been the most work I've ever done, but the most fun. I mean, it's given me the freedom to kind of direct what I want in the way that I want. And it's been beautiful in terms of just the kinds of people that are finding me through word of mouth, and it's grown. So it's been a lot of fun.
Yeah. It's beautiful.
Yeah.
And so the name of your practice is
Heart-Minded Medicine.
And why did you come up with this name?
Yeah. So it was when I was trying to figure out what is it I'm doing? And I've always been really drawn to the mind-body connection. Not a great term, but it is what it is.
It is actually a great term. I think we just use it so much that it doesn't mean anything anymore, right. But it is a great term.
Yeah. And I was going on a walk, like a walking meditation, and it came to me that what it is like, I think we know many times what to do in our head, but it doesn't really create health and healing until we've figured out how to move from our head into our heart. And that's where the change and the transformation happens. So heart-minded medicine, and I played with different ways, but it really felt like that's what I want. I want to be able to help individuals on their health journey, on their wellness journey, or whatever they want to call it, and understand, but also be able to truly integrate what they know. And then I'm their coach. I'm the person that can help them. I'm not telling them what to do. I need to meet everybody where they are and what they're ready for. So I feel like that's where the heart comes in.
Mm-hmm. And how did you start? So I have a very similar understanding of what health is, and I fully agree with you. And I had never heard of this until my own health journey when I was diagnosed with stage 4 breast cancer, and I followed with a Qigong master, and she would tell me, you've got to center into your heart, and she would put it here on the chest. But I was like, I don't know what she means. In your, and so I just wonder, so I have grown a lot since. Yeah. It makes a ton of sense now.
Yeah.
But for you, how did you come about realizing this?
Wow. I could go back into long history, but, I think it's been my entire life in a way. I haven't had my own personal health I mean, yes, I have health issues, but that's not been it. My mother passed from leukemia when I was 18.
Sorry.
And I think that was the first moment at which I knew I watched her pass. That was, and it was back in the 70s with late 70. She died in 80. And so during that journey, we had gone to Elizabeth Kubler-Roth's together and before she was sick. But I really remember that experience of watching her pass. And then I was very aware of my father's pain. I was probably displaced my own pain. And I was about to go to college. So it was like 2 weeks after she passed, I went to college. And I knew at that time that, you know what, life is experience. I want to live my life. Yes, I want an education. And I'd been working in a bank up until that point. I knew I wanted to go to college. I wanted to do something in healthcare. I didn't know what. So that was sort of the initial thing. Then I fell in love with classical studies and I majored in ancient Greek and classics.
Wow.
That was because I was searching for meaning. I think everybody does at that age in a way, but I think it was also like, what is this all about? And then I ended up finishing. I was going to the Peace Corps, changed that because for a number of reasons, but ended up working in Boston for a large medical group, kind of like, okay, do I want to go into, I never really wanted to be a nurse. I never wanted to be a doctor. I was thinking I was going to do physical therapy when I first went to college. And then I thought, well, maybe I do want to do, but I was interested in mind. So I was interested in psychology. I was interested in alternative stuff, and I was interested in medicine. So I ended up, because I come from a very medical background. So I was working in this big group. It was a multi-specialty group. And there was a doc, his name was Gilbert Mudge. And I was working as a medical assistant. And I went and I brought him, he was a cardiologist, brought him EKG, his the EKG, the x-ray and whatever. And anyway, we were in a back conference room. I brought it to him and he banged his head on the x-ray and said, "Why is it all I see are normal hearts?"
Wow.
And that was a moment,
Wow.
right, at which I said, this is not what I want. But in that practice, there were nurse practitioners and clinical nurse specialists who were spending the time educating and caring. And that's where I learned about the role. So I said, you know what, that's what I want to do. But I also was thinking, well, do I do psychology or do I go to Bastyr for naturopathy? And I knew that in my background, I wanted a more conventional. I didn't think I needed to be and didn't want at that point to be a doctor. But I thought the nursing has a holistic view.
Mm-hmm.
So then I did a number of things, got married, had kids. I have a son that's living with schizophrenia. Mm-hmm. And that's been a huge educational and needing for advocacy and respecting and understanding who he is. I've had other traumas through my life with my children, went through divorce. Life is my education, life is my experience, but I feel like I've always been very philosophical in how I see things, but I also want to be in the lived world. Yeah. So I studied, I've done all kinds of different religious experiences and spiritual, right? Spiritual, yeah. But I think really I'm living in this world and we're embodied beings, and I feel like I want to work within the physical, but connect those two. So I think that's a long answer, but that's why I think the culmination was I've always worked with physicians, and I love that collaborative thing. And so it was a very big step for me to say, I guess I can do this on my own. But that was after 25, 30 years of working. But it was at a time where, okay, I can do this, I think. But I still love the collaboration, and it's not one person. There's different tools that people need and kind of helping people access what they need, whether it's medicine or herbs or lifestyle changes, techniques, Qigong, I think that's everyone, tools. Healing comes from identifying the tools that work for you and you resonate with. It's not me telling you what to do.
100%.
So that's my story.
100%. Well, I love your story. It's beautiful, and it starts early. Yeah. Starts early for sure. I think that at 18, I was just in the path of being a doctor, and that's kind of like the only path, to the point that you forget the things that are around because you're so. I was driven, and I did become a physician, and I'm very proud of what that young woman achieved. But it is, I think this is the way that medicine should always be, and should, to me, I think that we are so, like, there has been so many advances in the Western world, Western medicine world, that we become technicians. And while I do think that it is really, really incredible, the advances of medicine, like incredible, we are forgetting that we live in an environment of humans, to the point that, like, I remember before I left my institution, we were starting to talk about how do we decrease the amount of time we have with patients. And I was like, I don't know that that's the question we should ask. You know, and it's like, how do you make, like, and you start like seeing that you're spending more time on the computer than you're seeing the patient. And it's actually funny. Like, I recently saw a new oncologist because mine retired, which is great news because that means that I've outlived her. I mean, not lived, but outlived her career right now. And I did tell her that she should come at UnabridgedMD, that I would love to have her as a physician in our practice. So a wonderful human being. And the new one, I mean, of course, you know, I have this relationship with this previous one, but she hardly looked at me. Yeah. She was on her computer, and I get it. It's important. But I'm like, I'm in remission. It's not very difficult right now. Yeah. Create the report, create the relationship. Who cares about the data? That's anyway in the computer. So we spent my 45 minutes appointment, and I think she went way over, and I'm not completely sure why, but because ultimately what she did was just reading the chart, and I was like, I know my story, the chart knows my story, and I'm sad because we lost the opportunity of a really good relationship. I'm sure she's wonderful, and I'm, you know, giving, you know, it's okay, but it just reminded me of how the computer is between now, right? Like, it's between the patient and me. And I do love my computer, and I take my own notes, and I know that people are using AI and so on. But I don't think we're technicians first. I think we are first human that came into this field to heal others and to help heal others. And the technicalities are just an added benefit, and it's a toolbox, right?
Right. Yeah, I think the people are coming to probably your practice and mine because they're not being heard. They're not creating relationships with the person that they want to go and try to trust with their health and with their symptoms that they don't understand.
That's the thing. They no one explains to them anything. And I'm like, wait, what? Right. What do you mean no one explained to you? And well, I guess I can understand, but it is actually funny because from France to the US, one of the big change was that in France, I felt like I could say anything. My patients would actually do things. Yeah. And then I came to the US, and there was a lot of pushback, and I was like, but you know that I'm on your side. Right. And so then that's when I learned how basically the patient has to be convinced of, you know, the treatment that you think is the best for them. And so it's actually funny now. I'm like, wait, so then my experience as a physician in coming to the US must be different than the experience of our physician, because apparently they don't need to convince their patient, or at least they don't care. Well, I don't think that that's the case, but it's actually funny. It's like, wait, like, so my patients will understand how to get to remission if they understand the path to remission. And so they give time to the medicine to work. And then they also complain if it's not working, not complain, but like tell us. And also, like, they understand how it functions, right? So they are not afraid of taking a medication.
I think it's such an important point, because I think that in the Western U.S. conventional world, the teaching seems to be, this is the medication, this is what you do it, you'll get better.
But that's never been that.
But it's not the truth.
I don't think it's ever been that.
It's been but it's so interesting that that's what a lot of people come and tell us, right? That I was told this, but there's all this other information, and people have so much information now,
that's so
right?
True. Yeah.
So I think that And what works for one person isn't going to work for another.
100%.
And so and part of it has to do with what that person's belief system is. If you're more afraid of the treatment than the treatment,
yes,
it's not going to work.
100%.
Most of the time.
No, absolutely.
Right?
Well, they won't take it.
They won't
or they
take
will
it,
have
or
a
they'll
side effect.
or they'll have every side effect.
Yeah.
You've got to I had a friend of mine who went through esophageal cancer, and he was very alternative, but he knew he needed to do this. He ended up going into the chemo and transmuting that medication into his own shamanic experience.
Beautiful.
In other words, he was able to take it and go, okay, this is good for me, and take my cells and do what they need. So he was able to allow himself to accept it.
I love that.
And I think that there's something to that capacity.
100%. But that's the thing. I think that this is where it's really hard, and I think I've come to terms with it, and I think I've figured out a solution. But basically, we have become technicians because an entity has told us that we are. Mm-hmm. And I think that is absolutely BS. Mm-hmm. And I'm calling this. Mm-hmm. And I think we are done doing this. Mm-hmm. And I think physicians are done because they don't want to become they don't want to be physician. I remember the dad of my kids when we had our kids, and they were very preemie. They're like a full trimester preemie. And he's like the smartest physician I've ever met. And he basically was like, no, if my kids become doctors, that would be a failure. Oh. And I was like, whoa, I love medicine. Like, why are you saying that? He's like, nope. Because, I don't know why he went into it, and maybe there was a little bit more ego than you can expect, but it's like, wait, so you hate it to the point that you don't want your kids to become physician, when to me it's a calling. When I was undergoing chemo, radiation therapy, surgery, I still went to work because I love it. Yeah. I really, truly love being with my patients. I really do. And I think the system has pushed physicians away from caring. Yeah. And because we are such type A personalities that we are always trying to do good. So if someone tells us that we need this and that, you're doing it this and that. So you're spending more time on writing, the notes, than you're spending time looking at your patient and talking with your patients. And it's crazy when you realize that the notes are, they're super important, but the vast majority of notes, how they teach physicians to write notes is to bill so that they get paid properly. And you're like,
it's all about,
this is crazy.
That's what I was going to say. It's the insurance industry. Yeah. And I'm thinking about the cost of going to medical school. Mm-hmm. So, you come out of medical school with huge debt. And you've got to get a well-paying job, and you've got to do it right, and it's got to be this and that. And then you're in a routinized experience where the powers that be that are controlling are saying, see more people, do more.
But that is BS. I think this is not real. I think this is, we think that this is the only way.
I don't think it is.
And it's not. And I think that physicians and nurse practitioners and, PAs and so on, I think that overall everyone has power. I think, and that's one of the things I love about the US, by the way. It's like you see a problem, you can create the solution to fix that problem, and very fast. Versus in France, I don't know that I could have done this in France so easily.
Yeah, interesting. Yeah. I think what we have to know is we have the freedom, we have the choice. Mm-hmm. But you've got to bring an awareness to that. And when you're in a system, we have blinders a lot of times, right? And we don't even recognize how we're becoming more jaded. Yeah. But that's why I'm so grateful to have been, anytime I joined a practice that became a big corporate structure, and there's a place for them. I don't want to diss anything.
Yeah, of course. Yeah.
But I'm so grateful that I've been able to stay small, stay within a smaller practice, and move when it became too much, right? Yeah. And this was starting my own practice was like, okay, we'll see what happens. Yeah. And I don't know anything about business. I just kind of, it's like you do it. I want to take care of people, and it seems to be unfolding in a way that so far is working.
I think it's the future of medicine. Yeah, I really truly and maybe you don't know, but so it's really funny. Like I don't want to say but apparently it was but it was, for me, it's the practice that was recognized as a top 25 most powerful woman in business in Colorado.
Yeah.
Well, congratulations to the practice, because when you're looking at the people who were around me, CEOs of like major companies and so on, I was like wondering, and the two main event sponsors were HCA and Intermountain Health, right? And I was like, wow, like why am I here? You know, and I realized it's because we are seeing this as the future of medicine. I really do think that this is the future of medicine.
I totally do too.
And so, I'm kudos to you for going on your own and creating this, because that's what our patients need.
They want it.
And that's what they want, totally. Yeah. So we are going to do full circle. 100% this is coming back to the big organization, and it just maybe won't be private equity, you know, because that's an issue when it's all about money.
Right.
Now, I want to go a little deeper into some of the things that you were telling me are, you know, some of the things that you really like doing, which are like hormonal changes and perimenopause. And so you have been, as you mentioned, in this sphere for over 20 years.
Yeah.
So there's so much that has happened in the last couple of years.
But
before that, can you tell us a little bit, like, how were we seeing perimenopausal women, you know, and what were we doing with them, and what are we doing now?
Yeah, I was around I started doing some hormones because a patient came to me and said, hey, do you do anything with bioidentical hormones? And this was back in probably 1999, maybe 2000. Before the Women's Health Initiative that got everybody off hormones. At the time, cardiologists were putting women on hormones, and the neurologist, you know, for heart and brain. And then the Women's Health Initiative came and it was completely, you know, stopped because of the cardiovascular stroke risk and the Prem-Pro. And then they also kind of misinterpreted the breast cancer risks and got everybody scared, and all of a sudden went from the most prescribed estradiol to Premarin or whatever to nobody on it. And in the midst of that, and I can't remember exactly where, I was starting to work with these bioidentical hormones through a pharmacist and a nutritionist in Kansas City because of a patient.
So what's the difference for the layman, right?
Yeah.
What's the difference? Can you explain the difference with the bioidentical hormones and what they were using in the...
Well, what they were using at the time of the study was Premarin, which is horsemeal urine, and medroxyprogesterone acetate. And it was oral Premarin. And Premarin wasn't all that bad, but it was not our own body's unique biochemical estradiol, which is now very available, right? Estradiol is available as a patch, oral, and so forth. I think what they learned in that study was really that we don't, in most cases, want to use oral estrogens because that goes to the liver and increases clotting. And then the medroxyprogesterone acetate is simply a bad drug. Nobody should be on it. It's what really caused the clot. It was that arm that caused everybody to get pulled out because of the stroke risk. They also were saying that don't start any women over, you know, you could, well, at some point they went and looked at it and said, okay, you can do hormones, but only when you're having hot flashes, and only for 4 or 5 years. And then you need to get off as soon as possible because it's not good as you get older. Yeah. But a whole generation of women lost out on this treatment. That is very real and very true. And only in the last, I think, probably the combination of all of these new Instagram docs and Oprah and a lot of education and women demanding, and now it's not just the postmenopausal when you're having hot, but all the women that are recognizing, gosh, all of these symptoms, whether it's joint pain or brain fog or depression or anxiety, these are hormonally influenced, not necessarily full cause, but certainly influenced by changes in hormones that are influenced by the environment, what we're eating. So there's a whole lot more understanding and education. I tell my patients, I went to several conferences last year, and the breast specialists were saying, you know, there was one title which I loved, which was the breast cancer, the metabolic disease we didn't see coming. And basically she came right out and said, hormones do not cause breast cancer. Now, it doesn't mean that you're going to give everyone you're not going to give everybody hormones, But it is like kind of looking at this differently, that we need to look at our immune system. We need to be healthy overall. And then you don't give supraphysiologic doses. We have hormone receptors in every cell of our body. We have them when we're in embryo, So it's not the hormones that are all bad. They're not right for everybody. So I'm not saying that. And I do think you want to be careful and you want to make sure people understand, right? So it's all about empowerment and understanding, and it's another tool. Some people choose not to do hormones, but there's ways you can adjust your hormones without having to do hormones even. So I think that the last 4 or 5 years, there's been this huge explosion that I think we can go the wrong way too. I mean, I think to say that hormones are everything and everybody should be on them, and high doses, or however, there's ways to do it, and it's nuanced. But I do think it's like we're talking about the pendulum going around with medical stuff and the insurance industry. It's also how do we it's the same thing. So but I love that we have more choices now. I felt for a long time that I was underground, and so I was like, okay, yeah, there's options. And I don't feel like you have to do compounded. I don't think compound's the only way. I do think compound can be options. But now there are definitely pharmaceutical medications that are human identical that can be used very well through insurance and work very well. I think a big conversation right now is testosterone for women, and where does that come into play, and how do we use it, and how is it safe? And again, we have, as women, more testosterone in our system quantifiably than estrogen in reality, but it's always been the man's hormone. So I think there's just a lot of empowerment that's happening in the world, as chaotic as it is. And that's the beauty of this change that we're seeing. So
I think that's really cool. It just shows again that women have to be where it's happening, right? They have to be in the room. And it's really cool as a woman to see the changes that are happening and to realize that it's only because women before us have been there, right? So whether it was political, then education, medicine, research, and now we're like, okay, and then advocacy for women. Like women are finally screaming that they want something, right? Like screaming. I really, that's what I see.
It's huge. I mean, but there are so many people, and not just women, but definitely women that, go to try to figure out what's going on, and all the tests are normal. You're fine.
Exactly.
You're fine. Go, maybe you need a psychiatrist.
But, I mean, come on, this is so common. So many of my patients come and that's what they've been told. But if you go deeper, they may have an autoimmune disorder. And then suddenly they have treatment and they're perfect. Or as I'm not into, like I don't do hormone therapy. That's not my zone of genius. But I can see some people who are like, I was depressed and suddenly I'm not. I felt that my cognition, like my ability to function was going down. And then bam, like no problem now that, I'm well treated and exactly. So it is very, it's wonderful. And I really hope it's going to be, because we hardly learn this in medical school. We don't. No. We actually do not learn how to manage hormone, like other than endocrinology and so on. So super exciting.
I was always really shocked that endocrinologists don't work with hormones in general, right? I mean,
that's actually true.
It's so interesting.
It is odd, actually.
It is. It's like, well, wouldn't that be what they would do? But it's like only if there's a disease, the concept of the level of fatigue that people have, that's mitochondrial dysfunction now or whatever, but it has to be, if it's adrenal or HPA axis, it's either Addison's or cortisol or Cushing's, right? But that's anything disease. In between, right? Totally. And they'll deal with that. But anything in between, see your psychiatrist.
They don't know. they don't know. I think that's important. And to me, this is probably what that's what I call the Eastern medicine. It's not Eastern, I know, I understand, but it's just easy to understand. To me, and I always say this to my patients, I'm like, look, we are so good in Western medicine. if something is severe or life-threatening.
Yes.
We will save your life if that's the case. Like
Yeah.
we will, absolutely. If something is potentially destroying your joints, killing you, we will save you.
Yeah.
Right?
Yeah.
And that's super powerful.
great.
That's huge.
Yeah.
And then, but it's like for boo-boo, which are not boo-boo, which affect the quality of life of
Yeah.
our patients, right?
Yeah.
I find that there are so many other techniques, so many other much more subtle techniques that work for this.
Yeah.
And it's, really like sometimes something that's not life-threatening is going to actually cause, the other day I had a patient who said, I didn't want to leave. I can't leave in pain like this.
Right.
I don't want to leave if it's going to be like this. And you're like, well, it's time. It's time we take care of those patients, right? And we have treatments.
Yeah.
Sometimes we have to go outside of our box, but that's okay. Like we do have treatments.
Yes.
So.
And I think that's it. I think the specialists like you, the willing to go outside of the box is so important.
Yeah.
It's the ability to take, lifestyle medicine is real. What we put in our bodies,
100%.
how we act, how we breathe, all of that plays into
how we react,
everything, our choices. So,
sorry.
No, go ahead.
It is funny. I was just thinking until my own cancer diagnosis, and maybe a little bit before, because I was like starting to be explaining meditation to my patients and, biofeedback and so on. But really it's until I got diagnosed and until I was like, well, this has helped me so much. This literally helped me just as much as the chemo. Yes, the chemo, the biologic, absolutely really helped.
Yes.
But I responded probably way faster, way more deeply, because of all of those techniques, right? The lifestyle medicine that changed my diet, that changed, I exercise, I did a lot of meditation and visualization and so on. And I think there is so much science behind this. Yeah. And like it's time, and it's this, it took me a while to share it with my patients. And at first I would share it only as, well, I'm sharing this, but it's as a patient, right?
Yeah.
So it doesn't have the same value. I started, researching it and realizing that lifestyle medicine is a huge one. Yeah. Except that we don't have advertisement for it because there is no money to be made. Yeah. That's exactly it, right? And it's the getting outside of the box is exactly this. It's at one point you have to realize that we're not in testing like setting. We are individualized practice.
Yes.
And so each of our patients deserve, I don't know if that's the word, but deserve us to think outside of the box, because it's like each patient is individual. Like the response is going to be different depending on the patient.
Yeah.
On their value, their belief, everything that you just mentioned earlier. Yeah.
Yeah. No, I think that's it. It's beautiful when it happens. Our capacity to heal and to change and to grow is really what it's about. It's and I think sometimes it takes crises for people to shift, and that's why I think so many people that go into the alternative or outside the box world have taken what their life experience is and allowed it to transform and inform how they live and how they work with whatever they're doing, whether they're in health or whatever. I think, and that's where there's some of the research has been done on the spontaneous healing or it's fascinating because
it's not spontaneous.
It's
right?
not.
It's radical remission.
Radical remission.
I love that book so much.
It's phenomenal. And there was a psychiatrist, I can't remember the name, but he was in Harvard. He was doing a lot of research.
I think it's Siegel. Isn't that Siegel?
Well, I know Dan Siegel's one of them, but it was somebody else. It was a recent book that I heard maybe 3 years ago. But it was kind of, he was really reluctant to study these states of healing. And then eventually did, like people with stage 4 or whatever, and it's given you 6 months. What is it was common to each of them? And yes, diet was important. but it wasn't the same diet for everybody.
Yes.
And yes, it was this and this and this. But one of the most important things was each person made a radical change.
Yes.
Like they had been an attorney for years. And what they really wanted to do was be an artist. And suddenly they were doing that, right? So they lived into what their passion was.
Yeah.
And that somehow was the culmination of it. You
Yeah.
know? So there's something about being able to, I love being able to witness that opportunity for change in little ways. I mean, I'm not dealing with cancers in most cases, but it's that ability to kind of take your experience and reframe it in order to no longer be limited by how we identify ourselves, right? This is who I am. I'm always like the person you mentioned about living in pain. I mean, who wants to live like that? You don't. And until you free yourself as through finding the person that can meet you and help you, then you start seeing hope again. You start seeing the ability to change, and you no longer have to be identified with that illness and that pain, and it changes. May not go away 100%, but it makes it livable.
Absolutely. I think it's exactly that. It's an opportunity always, right? It's what is your body telling you? What is it? What is that? It's almost, if we really pause, and it's funny, like I really learned that when I had cancer, and for many, I was like, I wouldn't share it with anyone at first because I was like, people are gonna think I'm crazy. But it's this ability to be like, okay, I'm at peace. I don't know what's gonna happen to me, but that's okay. And what is my body telling me? Like, what can I learn from this situation, right? And I had to choose. I remember that. I had to choose. So when you say, you can see the shift, but your patient I have to be able to share that with you. And this is where we're lucky, right? I mean, we're lucky, and also we chose this, where they actually get to share all of the shifts that are happening to them. I remember this patient, after I asked him, I was like, well, can you tell me all of the good that rheumatoid arthritis has brought to you? And he came back, and it had been really hard to get him to remission, very hard. He either would have side effects or things like that, or it just wouldn't work. And then he comes back with his parents. And it's an adult, right? It's like, no, I came back with my parents because I want them to be witness of what I'm about to tell you. And what I want to tell you is thank you for this question, because I've realized that I'm going to write a book. And I'm going to share how much this has helped me in my life and how having rheumatoid arthritis has actually helped me. Well, this patient who I had been trying to get into remission for 2 years, which for me is a very long time. My patients should be in remission after very, very short after they see me. And they do, most of, like the vast majority of them. So for me, I was like, what's happening? And he went into full remission, I think he had like a couple of flares, but hardly any really. And it was related to stress. And and he's writing his book. Writing his book. I don't know that it's been published just yet, but
that's great.
It is really good, and it's this realization that we are not victim, right? Or it's not like, oh, the world is happening to me and I'm so unlucky. I mean, everyone has a bowl of salt that they have to deal with.
No one promised us a rose garden kind of thing. It's like
true. And they have thorn anyway.
That's right. That's it. They're thorns we have to deal with.
we do. No, that's wonderful. So the podcast is about hope driven by science. So it's really about hope, and this is, like, to me, the most important thing in life, actually, really. Do you have a story that you would share with us about a history that would embody this? So many, I'm sure.
Yeah, trying to find one. Well, there's some very complicated things, and then there's some very simple. And I think so. There was a young woman who was dealing with chronic pelvic pain, and was diagnosed with lichen sclerosis, a lot of anxiety, and had been living this for a long time. So one of the things that I did invest in is a pelvic floor device that I really love, that is vaginal rejuvenation. Well, one of the things that it can treat is lichen sclerosis. And so she had a number of other things going on, but she was willing to do this. So we started there. I'd been working with her for a while on some gut stuff and so forth, but we did that. And oh my gosh, it was like, with the 3 treatments we did, they were difficult and painful. And there was a lot of emotional stuff. So her physical body was responding emotionally too. But amazingly, and this has been now 2 years, I think, maybe a year and a half since she completed the treatment. Afterwards, she was able to have sex with her husband without pain. But we ended up also kind of doing that. It got her started. Then she was motivated to let me work on my gut. So we did a bunch of stuff working on kind of healing the gut, working with her anxiety. She was struggling with anxiety. She was also committed at that point to become a therapist to work with women in particular with chronic conditions, especially chronic pelvic pain. She did PT, she did other things. So anyway, that was one of the most, it was the first one I did that was like, oh my gosh, this truly works. Yeah. And her capacity to then take that, to then want more and do more deep work. And, she's got some ongoing stuff going on for a number of reasons, but she's a beautiful human being who was able to take this pain, be willing to kind of go into it even more, but then to see hope. And then be able to go, okay, now I'm ready to do this. And now I'm ready. And that's what I see so often is you start with one thing and it kind of propels people into, oh my gosh, I can feel better. I don't have to live with this forever.
Absolutely.
So
I'm allowed to heal.
I'm allowed to heal. Yeah. And then there's people that, there was one woman that was chronically depressed. And she was dealing with, doing all kinds of treatments, therapy, medications, and so forth. And finally, I think her psychiatrist referred her to me for hormones. And like you said earlier, in a short time, she was like, oh my gosh, I felt so much better. And she was able to cut back on some of her meds. And so there's just really, it doesn't take much to make it really feel good about little things. And it's nothing that's magic. Mm-hmm. It's like, just giving people the opportunity to see things differently and make some changes that my body can do what it needs to do. It's like reorienting and reteaching the body in a way. So
I love this. Thank you so much for sharing.
Yeah.
Well, where can our auditors find you if they want to work with you?
I have a website, heartmindedmedicine.com. And although I'm not really on Instagram much, I probably need to be, but at Heart Minded Medicine is Instagram. And I'm right here in Glendale at my phone number. I can give that so that people can access it.
Put that in the notes. Yeah.
So,
well, thank you so much for being here. It's been such a pleasure, and I'm sure we'll do a take 2.
Yeah, thank you so much. I really appreciate it. It's been fun.
My pleasure.
Thank you.
And for the auditors that have listened all the way to here, please follow UnabridgedMD and know that I'm very soon creating a webinar. I'm actually finalizing the webinar and a course on how to decrease inflammation in our body with a very holistic and non-medication ways.
Nice.
So there will be the science of why we do that and how to get there. And I think that this is going to revolutionize our medicine, even though we're coming back to techniques that are, very ancient.
Ancestors have done.
Exactly. But we forget to do them. And sometimes we have to go back to the basic. So that's what I'm going to teach. And I love it. And I think it's really exciting.
That's great.
Yeah.
Good. Thank
Bye.
you.
Well, thanks again for tuning into the UnabridgedMD podcast. Be sure to subscribe so you can be notified when the next episode is up. And as always, if you think that this would be helpful for a friend or a family member, please share. Wishing you wellness. Until next time, take care.